Good evening. Tonight we're diving into a topic that affects us all, the pharmaceutical industry. These companies produce treatments that have extended lifespans and eradicated diseases. But what happens when the pursuit of healing collides with corporate profit? It's a question that might make you uncomfortable, and frankly it should. We're talking about a multi-trillion-dollar global industry with immense lobbying power. So, let's ask the uncomfortable question. What if the world's most trusted medical giants aren't looking for cures, but customers for life? Tonight, we're not peddling conspiracy theories. We're examining patterns, asking critical questions, and looking at the evidence. We'll explore historical precedents, delve into the economics of drug development versus marketing, hear whispers from insiders, and try to understand how a system designed to save us might have a vested interest in keeping us just sick enough. So grab a cup of tea or perhaps something stronger, because this is going to be quite the journey. If you think the idea of pharmaceutical companies prioritizing profit over patients is new, think again. Remember Martin Shkreli, the pharma bro who hiked the price of Daraprim, a life-saving drug, from $13.50 to $750 per tablet overnight? That's a 5,000% increase. The public outcry was immense, and Shkreli became a villain of almost cartoonish proportions. But while Shkreli was an easy target, the system that allowed him to do what he did remained largely intact. He was a symptom, not the disease itself. The mechanisms for acquiring old drugs and jacking up the prices, still there. Consider insulin, a drug discovered nearly a century ago, the patent for which was sold for a mere $1. Today, the price of insulin in the United States has skyrocketed, forcing some diabetics to ration their doses with sometimes fatal consequences. We've seen list prices for common insulin products triple or more in the span of a decade, despite no significant changes to the drug itself. This isn't about recouping massive R&D costs for a brand new discovery. This is about wringing every last cent from a captive market. It's a historical pattern of exploitation hiding in plain sight. Let's move into the present day, into the heavily advertised world of modern pharmaceuticals. The sheer amount of money poured into marketing by pharmaceutical companies is staggering, often dwarfing what they spend on the actual research and development of new drugs. More money is spent convincing you or your doctor that you need a particular pill than is spent discovering if that pill is the best possible solution. Are they selling cures or selling sickness? This type of advertising is only legal in 2 developed countries, the United States and New Zealand. Coincidence, perhaps? Or perhaps it's an incredibly effective way to generate demand. And it's not just ads. There's the army of pharmaceutical sales representatives, charming and well-rehearsed, visiting doctors' offices, offering samples, sponsoring lunches, funding educational seminars. The goal? To influence prescribing habits, to ensure their company's drug, often the newer, more expensive one, is chosen over older, cheaper, or generic alternatives that might be just as effective. They're not just selling a product. They're shaping the perception of illness and treatment. This isn't to say all pharmaceutical marketing is inherently evil or that doctors are easily duped, but the sheer volume and financial muscle behind it creates an undeniable pressure. When the machine is geared more towards expanding markets for existing drugs or slightly tweaking old ones to get a new patent and a new marketing campaign, rather than pouring every available resource into finding genuine cures for intractable diseases, you have to wonder about the fundamental priorities. Are we investing in breakthroughs, or are we investing in brand loyalty for conditions that might be managed but never fully resolved? It's one thing to observe these patterns from the outside. It's another when those on the inside, the scientists, the researchers, the executives, decide to speak out. Whistleblowers in the pharmaceutical industry are a rare breed, and for good reason. The personal and professional risks they take are immense. Yet some feel compelled to come forward, often armed with information that paints an even more disturbing picture. These insiders have brought forth allegations, and in some cases, damning evidence of practices that seem designed to protect profits at the expense of public health. Insiders have revealed suppression of affordable treatments, documents that were never meant to see the light of day. We're talking about claims of research data being selectively published or even manipulated to make a drug appear more effective or safer than it truly is. Imagine a scenario where a company discovers a simple, inexpensive compound that could effectively treat a widespread ailment. That's wonderful news, right? Unless, of course, that same company has already invested billions in developing and marketing a much more complex and therefore more profitable long-term treatment for the exact same condition. Suddenly, that simple, cheap cure isn't a breakthrough, it's a threat to the bottom line. Whistleblowers have described situations where promising research into non-patentable or less profitable treatments was allegedly defunded or quietly shelved. Then there's the issue of evergreening patents, making slight modifications to existing drugs to extend patent protection and keep cheaper generic versions off the market for longer. Or pay for delay deals, where brand name manufacturers allegedly pay generic companies not to release their cheaper alternatives. The courage of those who expose such practices is crucial because without them, we might never know the full extent of how commercial interests can sometimes overshadow the quest for genuine medical progress. The alchemist's dilemma: miracles, money, and moral mazes. Pharmaceutical companies and the brilliant scientists who work for them have been responsible for some of the most incredible, life-altering breakthroughs in human history. We're talking about vaccines that have virtually eradicated diseases like polio and measles, antibiotics that turned once fatal infections into treatable conditions, and revolutionary treatments for cancer, heart disease, and countless other ailments that have extended and improved millions of lives. This is not up for debate. The good they do is immense and undeniable. However, it's the however that keeps us up at night. Yes, pharmaceutical research saves lives. But when profits outweigh healing, what happens to truth? The research and development process for a new drug is incredibly long, astonishingly expensive, and fraught with failure. For every successful drug that makes it to market, countless others fall by the wayside. Companies argue that the high prices of successful drugs are necessary to fund this risky and costly R&D. But where does that justification end and exploitation begin? When a company focuses its research on Me Too drugs, slight variations of existing successful drugs that offer little to no additional therapeutic benefit but can be newly patented and marketed, is that truly innovation, or is it a safer bet for shareholder returns? When research into diseases predominantly affecting poorer nations is neglected because the potential for profit is low, while lifestyle drugs for affluent Western markets receive billions in funding, are we prioritizing global health or market opportunities? The business model itself, built on intellectual property, patents, and market exclusivity, is designed to incentivize innovation through the promise of profit. And it has, in many ways, worked, but it also creates perverse incentives. A drug that cures a disease with a single course of treatment is, from a purely financial perspective, less valuable than a drug that manages a chronic condition for decades, requiring repeat prescriptions year after year. This isn't to say companies are actively avoiding cures, but the economic reality undeniably shapes research priorities, funding decisions, and the very definition of what constitutes a successful drug. It's a system that can, at times, seem to value a lifelong customer over a cured patient. The sickness economy, hooked on treatment, starved of cures, so we've seen the history, the marketing, the whispers from inside, and the inherent tension between healing and profit. What does this all add up to? It points towards something that some have called the sickness economy, a system where there's more economic incentive in managing ongoing illness than in delivering outright cures. Now, this sounds deeply cynical, I know, but let's just unpack it for a moment, calmly, rationally. The logic is uncomfortably straightforward. A patient cured is a customer lost. A patient who needs to take a pill or a series of pills every day for the rest of their life to manage a chronic condition. That's a reliable revenue stream. This isn't about conspiracy, it's about awareness. Are we consumers or test subjects in a system built on sickness? It forces us to question whether the entire healthcare apparatus, with Big Pharma at its financial core, is inadvertently, or perhaps even by design, structured to perpetuate a state of manageable, profitable illness, rather than striving for complete, unprofitable health. Think about the diseases that receive the most research funding and media attention. Often they are chronic conditions: diabetes, hypertension, high cholesterol, arthritis, depression. Treatments for these conditions are multi-billion-dollar markets. And while managing these conditions is incredibly important and life-improving, one has to wonder if the same level of cure-focused intensity is applied across the board. The focus often seems to be on developing the next blockbuster drug that patients will take for years, not necessarily the silver bullet that eradicates the need for ongoing treatment. This sickness economy model doesn't just influence research, it can permeate medical education, shape public health policy through lobbying, and define how we, as a society, approach health and disease. It can lead to an overemphasis on pharmaceutical interventions at the expense of preventative measures, lifestyle changes, or less profitable, non-patentable therapies. It's a subtle, pervasive influence, not a shadowy cabal meeting in a volcano lair, but its effects can be just as profound, potentially locking us into a cycle of dependency where true wellness remains just out of reach while the meter keeps running. Beyond the pill bottle, demanding a prescription for change. If we accept that there are some deeply problematic incentives baked into the pharmaceutical pie, what do we do about it? It's easy to feel overwhelmed, perhaps even a bit powerless when faced with an industry of this scale and influence. But despair, while an understandable first reaction, is ultimately as unhelpful as a chocolate teapot. The first, most crucial step is awareness, the very thing we're trying to foster here tonight. Understanding these dynamics is the prerequisite for any meaningful action. Once aware, we can start to leverage our collective power. Patient advocacy groups, when truly independent and focused on patient welfare rather than pharma funding, can be incredibly powerful voices. They can demand transparency in drug pricing, shining a light on the often opaque journey from lab bench to pharmacy shelf. They can push for clarity on how R&D costs are calculated and how much of that is truly reflected in the final price tag. We, as citizens and consumers, can support organizations that fight for fair access to medicines and challenge anti-competitive practices that keep prices artificially high. Then there are the bigger systemic changes that require political will. We can advocate for reforms in patent law to prevent abuses like evergreening or pay for delay schemes that stifle competition from cheaper generics. We could explore alternative models for funding drug research, particularly for essential medicines or areas neglected by the market, perhaps through more public investment or prize systems that reward genuine breakthroughs rather than just market longevity. And critically, we need to demand far stricter regulation of pharmaceutical marketing and lobbying to ensure that medical decisions are based on evidence and patient need, not on persuasive ad campaigns or political influence. This isn't about dismantling the pharmaceutical industry. That would be ludicrous and counterproductive. We need innovation. We need new drugs. But it is about rebalancing the scales, about ensuring that the pursuit of profit serves public health, rather than the other way around. It's about fostering a system where the brightest minds are incentivized to find cures, not just create lifelong customers. The prognosis, your health, your voice, your choice. So there you have it, a journey through the complex, often contradictory world of big pharma. We've seen how the drive for profit can lead to some deeply troubling outcomes: exorbitant prices for life-saving drugs, marketing that sometimes seems to prioritize sales over science, and a system that might find more value in managing sickness than in eradicating it completely. It's a landscape filled with brilliant scientists doing life-saving work, but also with corporate strategies that can feel at times utterly divorced from that noble mission. This video isn't about providing all the answers, because frankly, the answers are as complex as the problems themselves. Instead, the aim has been to arm you with questions, to encourage a more critical eye when you see that next drug advertisement, or when you hear about the latest miracle treatment with a price tag that could buy a small car. It's about fostering a healthy skepticism, not a cynical rejection, but a demand for greater transparency, accountability, and a healthcare system that truly puts patients before patents and people before profits. The power to change this narrative doesn't lie with one person or even one organization. It lies in collective awareness, in public discourse, and in the choices we make as informed citizens and consumers. It's about understanding the system, questioning its incentives, and advocating for a future where healthcare is driven by human need, not just market demand. So ask yourself, are we getting healthy, or just being sold survival?